and I want to welcome people to this event. We are here at the Bipartisan Policy Center in Washington, D.C., and we're about to hear from 10 state child care administrators about what worked, what didn't, and what's next for child care in this time of COVID. So the next slide is simply going to give you the overview of BPC. We are a nonprofit organization in Washington. We try to take the best ideas from both sides of the aisle to get consensus on how we move forward in this country. Here in the work that we're doing, as I said, I direct the Early Childhood Initiative. We work with a variety of stakeholders to try to build a high quality early care and education system that supports all of our families. Next slide. Just going to go quickly in. I just want to say one thing, and we basically did a parent survey. As many of you know, we did a webinar on this a while back. Here's some of the findings of that, but I want to basically say that keep going to the slide you were on. No, before the previous one, if you would. Okay, what we did was take a look from the parents' perspective about what's going on, because it's extremely hard to get a representative sample of childcare actually itself. So going through parents, we were trying to figure out what was going on. I think the only thing I want to add to this slide, and there's a whole bunch more and you can go look at it, is why we have these people on this call today, and that is that by overwhelming numbers, 75% of the parents, when asked if they knew about their state's plan for childcare, knew about it, and over 80% of those parents were very happy with what the states were doing. And I think that speaks volumes for the people on this call, because all of us were thrown into uncharted waters here and had to make the best of a really, really bad situation. So with that said, I want to move right on to what is going to happen today and have a discussion of what has happened in terms of its implications for childcare, what we've learned, what's going on right now, and hopefully where we are going with this. What do we need to do next? It gives these people an opportunity to speak to policymakers here in Washington, D.C. and others around the country about what they've learned. So I'm going to quickly go down the roster on this, because I'm not going to read people's bios. If any of you don't know the folks that are on here, I could refer you to bios for each of them, but just let me tell you who they are and what state they're from. Well, we're going to begin in a minute with Janice Molnar, Deputy Commissioner for Office of Child and Family Services in New York State. Sarah Neville Morgan, Deputy Superintendent for Teaching and Learning Support at the Department of Education in California. Tracy Gruber, Director of the Office of Child Development in the state of Utah. Kara Bertkey-Wendt, Assistant Director for the Department of Job and Family Services in Ohio. Matt Judge, Administrative Regulations Analyst with the Department of Early Learning in Washington. Sarah Vanover, Director of the Division of Child Care for the Commonwealth of Mississippi. Todd Landry, who is the Director of the Office of Child and Family Services in Maine. Susan Perry, who is the Chief Deputy Secretary for the Department of Health and Human Services in North Carolina. Teresa Hawley, who is the First Assistant Deputy Governor for Education in the Governor's Office in Illinois. And Samantha Trewergy, who is the Commissioner of the Department of Early Care and Education in Massachusetts. What we tried to do when we asked these people to participate in this was look at states who had a high impact, and then also can have a balance in terms of political or party, affiliation, or not party affiliate, but just red state, blue state stuff, let me say that. So I think we've got a fairly balanced group of people here. We have asked them to each take about 6 minutes to give an overview of what has happened in their states and sort of where we're going with this. We will be taking questions from those of you who are on this call, through the chat. We asked for questions in advance of the call, and we actually got over 30 questions, which we have questions plenty, but please send yours in, because if they will help guide the conversation as we move on. So we're going to turn it over quickly to Janice Molnar from the state of New York, who we all know has been hit very hard New York received $118 million in the Supplemental CARES Act. We're pretty sure, Janice, you must need more. So I'm going to turn it over to Janice.
Thank you very much, Linda, and good afternoon, everyone. It's really a pleasure to be here and to talk about what worked, what didn't, and what's next for New York State. The first slide, please.
Next slide. You're good, Jen.
Next slide.
We have the chart up, Janice, with the bar chart on it.
Thank you very much. On March 7th, New York State Governor Andrew Cuomo declared a state disaster emergency for the state of New York. With 2 local airports as primary gates of entry from Europe, and with New York City a prime tourist destination for both international and U.S. travelers, New York City was a primary gateway, along with California and Washington, of COVID-19 to the rest of the country. What started small in New York became a flood. Until today, we see that of the 1.7 million known cases in the United States, 21% are in New York State, and of those, 55% in New York City. Of the tragic fatalities, known to be 101,000, attributed to COVID-19, 23% of those are in New York State, and 16% of the total in New York City alone. Next slide, please. Panic set in March in New York State in the child care community. On 2 days in mid-March, and you see the spikes on the chart on the graph here, almost 3,000 providers closed their doors. Next slide, please. These are numbers from 2 days ago. Numbers are incredibly fluid, and they're going up in ways that we're not sure we understand right now. But we have approximately 1/3 of our, actually 37% of our total base of providers are closed. Not surprisingly, at the bottom row of the chart, school-age child care, many of those programs are located in schools, and our schools were closed. 69% of them are presently closed. Daycare centers are also especially hard hit, and where families seem to be gravitating are the family-based programs, family child care and group family child care. Yes, there are some closures, but not as steep as with the center-based programs. We believe it's related to parents' notions of safety, wanting to guard against infections, and staying near home, especially in areas like New York City where public transportation has become highly problematic, and so traveling to child care is much more difficult than previous. Next slide, please. This just shows the distribution across New York's 62 counties. There is a range of program closures, 20% to 65%. And as I said earlier, 37% of our licensed and registered programs are closed overall. Next slide, please. In family-based programs, family child care and group family, much smaller percentages of program closures, between 1 and 32%. So that's much more encouraging. But these two maps are not the whole story. Utilization rates are also very, very low, averaging 27% overall. Many programs, we have one that's near our state capitol. It's a center. Its total enrollment is 112 children. They presently have 5 in attendance. Next slide, please. So these were our actions pre-passage of the CARES Act. We focused in on supports for families and providers, primarily through our child care subsidy program. So you see on the slide, our supports for families included waiving the family share, expanding subsidy eligibility up to 85% of the state median income, which in New York State is pretty high, expanded the definition of child needing protective services, and extended the eligibility for child care. We are a state-supervised, county-administered state, so the counties have a lot of decision-making around this. We initially did 30-day waivers with renewals of 30 days and then 30 days as the effects of the pandemic have continued. Supports for families across the board, not just subsidized, but across the board we allowed much more regulatory flexibility around training requirements, clearance requirements, qualifications, inspections, mixed age groups, expanded ages to be served, case-by-case determinations because health and safety is primary, but we also knew that those programs that were open often needed to be expanded, and expanded the number of paid child absence days for subsidy programs and paid closure days. Going forward, next slide, we received $163.6 million through the CARE Act. Very important resources, but hardly enough. Phase 1, I will talk about quickly, stabilizing the system for essential workers. We provided tuition payments for the essential workers and direct grants for supplies for open programs. I will come back to Phase 2 shortly. Next slide, please. Just a quick overview of our CARES scholarships in terms of parent applications received and children enrolled, expenditures on supplies. We put about $30 million into this program to start. Next slide, please. Here you can see that, not surprisingly, 42% of those parents taking advantage of this program were from the healthcare field, a whole host of others, retail, first responders. Essential workers were broadly defined in New York State, and I should also mention child care was considered an essential service. So we did not close child care programs in New York State. They have stayed open. 41% of parents seeking care were seeking it for one child, 23% for two children. Next slide, please. This one is somewhat sobering. The question was, do you currently have a 2-week supply of? Those that said no, 42%, no on diapers, 47% no on gloves, 36% not enough of hand soap, 43% cleaning supplies, 49% didn't have a 2-week supply of hand sanitizer, and almost 2/3, 65%, did not have a 2-week supply of masks. Next slide. We worked very, very hard with our child care resource and referral agencies throughout the state. There are 35 of them, working with our divisional regional offices to partner together to deliver supplies. And I should also say that our CCR&Rs are also the leads on our scholarship program, determining parent eligibility and sending dollars to providers. Next slide. This kind of sets the stage for going forward. We did telephone interviews with over 13,000 child care providers in New York State on a base of 18,000. And I just want to highlight the concern of not having enough children to serve if they reopen, not having enough cleaning supplies, not having access to staff. I received an email just this morning from a CCR&R who had been speaking with many large child care providers who are struggling financially. They don't have enough children to open a classroom, and there's not enough tuition to cover staff salary at the same time as their increasing need by parents. I'm going to close with just highlighting as we look forward, lots of needs, restart grants, startup expansion grants in child care deserts, additional subsidy for families. We have not targeted the remainder of New York's CARES allocation because there are so many priorities, so many needs, it's almost impossible to prioritize in a way that is fair and meets the most needs of the most providers and the most families. If we have the opportunity later, I will be happy to take questions, but right now, thank you.
Thank you so much, Janice, for that. And wow, I mean, I think we knew starting with you that the impact was overwhelming in New York, and we really appreciate your hard work and amazing data. To be honest with you, it's very impressive. Thank you. Next, we're going to turn to the other coast to Sarah Neville Morgan, who is the Deputy Superintendent for the Department of Ed in California. And Sarah, I'm going to let you take it away. I think Sarah may still be muted.
hear me now?
There she is.
Okay, great. Sorry, and I was talking away at you, so that doesn't help very much. To back up a little bit, just a quick thank you, Linda, for inviting California to be part of this really important conversation. And I always have to give a shout out to my team who has worked above and beyond, like I'm sure all of these states agencies have, to really address COVID-19 needs across their state, and to our partners and contractors on the ground who have also gone above and beyond. Anytime you think you can't work any harder, it seems like we get one of these new challenges that means everybody rallies back together. So going on to our first slide, not that one, the next one, although that beautiful baby from one of our tribes, I always love to highlight. We had in California a really good picture before the COVID-19, and I'm sure a lot of other states saw that too, where we had a governor, we had 118 straight months of growth, a projected rainy day fund of $18 billion for 2021, a governor and a separately elected state superintendent of public instruction who were both extremely committed to the early years, whole child, and supporting families. California was poised from our January budget to make major new investments to an already $5 billion early learning and care system that serves over 400,000 young children. So on the table, we had dramatic expansion of pre-K, record investments for the early learning and care workforce development with $195 million going out to help our workforce, facilities investment of $263 million, other expansion around vouchers and subsidized early learning, and some other connections to whole child, like increasing paid family leave and home visiting. So we had this wonderful picture that I'm sure a lot of states also had, and now we're looking at something very different. So sorry, I probably am going to forget to keep telling you to invest. Oh, good, you did it. So now we're looking at a $54.3 billion budget deficit, complete opposite of where we were just a couple months ago. To balance that budget, the governor has proposed eliminating all of those wonderful things that I just shared a minute ago, as well as cutting our provider reimbursement rates by 10%. So there are other, obviously, cuts across our entire system that are really devastating, but those are just focused on the early learning and care. If those proposed cuts move forward and are enacted into law, it really will devastate California's already reeling early learning and care system and impact the greater economic recovery. Next slide. So our early learning care industry had already operated on a precarious business model, which I think is our common situation across this entire country. Overall solvency of this system is extremely fragile. Our educators live paycheck to paycheck. Our programs are always struggling to keep their books balanced. And all of those investments to support that were the ones that were taken away. We also know that there are high costs of providing care during COVID-19. The analysis by the National Women's Law Center and CLASP, they thought that the cost would be about 23% higher. From our California programs that have dove in and to really looked at their budgets, they're finding in about 43% additional costs related to reduced group sizes, to additional staffing. And so per classroom, that's about $11,600 just in COVID-19 costs. Pair that with a proposed rate cut, and you can imagine what our field is feeling like and addressing right now. Part of that are some of those new group sizes and ratios that every state is having to look at as they look at physical distancing around COVID-19, and the reduced capacity in our programs, in our classrooms, and the family childcare homes, looking at a 17% reduction in capacity for infants and toddlers, which is always the hardest to find, and then a nearly 60% reduction in capacity for our preschool programs. As we look at that fiscal stress, the Center for the Study of Child Care Employment did do an analysis in California in April and found that 57% of our programs have laid off or furloughed staff. That tends to be those that aren't part of the subsidy system. So knowing that CCDF and the Child Care and Development Block Grant take care of part of the system, but actually the majority of our early learning and care is more private pay. 66% of families are unable to pay or have lost their jobs or income, and 61% have lost income due to low attendance or families not being able to pay for their spaces. So a large share are really saying it's not today that's really bad, but it's tomorrow and out from there that it's really hard. As we look across California, and I realize our numbers are always a little bit staggering, I can't even wrap my head around them. We have just over or just under 42,000 licensed sites, licensed facilities across California. 72% of our sites are open right now, so nearly 30,000 are open, representing over 1 million children in those spaces. We have another just over 4,500 who said they're closed, but they really want to reopen. So they want to get back out there. And then another percentage who are just, nope, we're good, we're going to stay closed for a little bit. In asking our contracted programs that are actually part of our CCDF subsidized world, they've said the biggest concerns for them right now are staff, that their staffs are really concerned. So if you're bringing staff back into a program, how are you supporting them around their physical health and safety and impacts on their family? How are they addressing the physical distancing guidelines needed, which means they can serve less children and have to really worry about how they're juggling space throughout their programs, and then concerns that families might have. So those were the top 3 ones. Next slide. Through CARES funds and CCDF flexibility both, which thank you so much for being able to provide those for us. I think we all desperately needed those CARES funds, and we also needed additional CCDF flexibility. In that, we were able to issue guidance that really helped stabilize the field, at least in that moment, so that providers could still be paid if they were closed, and using some of the CARES funds for that. So we did that through California has a complicated system, but we actually have 2 ways where we do our subsidized system. So if you're a direct contracted program with us, more like a Head Start, early Head Start type model, they were able to be fully closed and retain their staff with that goal of making sure staff are still retained and having them provide additional supports to families through distance learning, through regular activities and outreach and family engagement, whether it be virtual or hard copies for families that didn't have access and were part of our digital divide, as well as having opportunities for staff to do professional development during that time. So we were able to keep those paying through that. And then through our voucher side, where the voucher is following the child, we were able to pay providers for 30 days if they needed to close, and then use the CARES funds to help support an additional provider if that family needed to go find somebody else. So both of those helped with it. We also had cleaning funds for providers. We issued $50 million that went out to our resource and referral agencies to support cleaning supplies, health and safety supplies, as well if they needed actually to have somebody come in and do a deeper cleaning in their program. And we were, with the CCDF flexibilities, able to recalibrate some of our quality activities to really meet the needs of providers during COVID-19. So they all had to shift if they were coming into programs to provide coaching or holding big PD sessions, shift to be able to provide those online. And then also some of our things like our QRS, Quality Counts California, actually started using their, instead of a stipend to a program based on their quality level, really pivoted and said, we're going to provide stipends to those who are open so they can pay their staff a little bit more. They actually had teams creating masks for young children in places like San Francisco and conducting coaching virtually, so that new pop-up programs across the state that were really attached to hospitals and other places with emergency childcare were able to sort of address their onboarding and do that. Next slide. One of the biggest things that we saw was that with so many programs needing to close or shelter in place right away, that we had a lot of early educators who wanted to access additional resources. So we already had something called California Early Childhood Online. We typically had about 500 users per month. Since March 1st, it exploded, and you can see on that chart we had 10,000 new users join it in that month. It shut down a couple times as they had to increase bandwidth for it, but the usage across the state in rural counties in LA has been phenomenal as they've dropped into things like our child observation tool, STEAM, family partnerships. We have some basic health and safety related to COVID-19 on there. So lots of explosion there. Going on to slide 7, we also were able to issue $50 million in CARES funds to serve children of essential workers and at-risk populations, along with guidance on how to prioritize that. So while the essential workers were really critical, we also, in partnership with our Department of Social Services, have been really cognizant of more family sheltering in place and increased child abuse and other situations that could be happening. So really wanting to make sure that families who needed to were also able to access care for respite, and for families who might be foster care parents and just needing, with schools closed and their typical child care closed, might be needing additional access to those supports. Working with our resource and referrals and Department of Social Services, we were able to have them, it's really DSS, I want to shout out to, launch mychildcare.gov, a tool that's really helping match essential workers with available early childhood, and all of our R&Rs have done a phenomenal job of gathering data, feeding it into that, so that we can have a state level one. And then continuing to fund spaces. So if a child is not able to attend their program, even if it's with a voucher, that child's space is still held. And lastly with that is waiving family fees. So knowing that a lot of our families were under duress, not wanting them to have to do that right now, not wanting that additional burden on our programs around collecting them. So yet another thing that our CARES funds have helped with. Those measures, next slide please, that I just described were really developed when we thought the crisis would be more short term. So we were in that sprint mode and everybody was working 14-hour days to get everything launched. But now we need to move more into a marathon. So thinking about the long-term implications, especially when you have both an economic crisis that really is taking us back into a depression era, as well as these really fragile early learning and care system that has always needed more, needing to do things differently because of the physical distancing and other COVID-19 health measures. So while the CARES funding was able to address that critical stopgap in the immediate, we need some measures and some funding that will really help sustain the system more long-term and move us into something that kickstarts that economy. So with that big vision, we don't want to just rebuild. I think we always said we need something different. How do we build something back stronger than before it was? How do we reimagine and proactively put in place and have funds that aren't just addressing the immediate, but looking at the infrastructure and how to guarantee that? So guaranteeing access, we really look at K-12. If that's guaranteed, where's early learning and care in a system where that can be guaranteed and not disappear when families need this desperately to get back to work. So looking at this more as a public good and completely reimagining how we're creating a universal program with sliding fee scales to make all of our programs more resilient. We also need to rebuild with that strong focus on quality. So it's not just ensuring that we're creating access and warehousing children, but where is it in there that the programs are fully supported so that they can serve more children, serve them well, focus on PD that goes beyond the health and safety that everyone's going to need. Who knew how important having, in California, one of our standards is using the environment reading scale tool, and that hand washing one that always got people low scores, and now they're all like, oh, that hand washing is coming in really handy with all of our signs around our programs. But they also need to focus on intentional, responsive child-adult interactions and rich multilingual learning experiences for all of our children. We need more resilient financial models and professional development along that career path. So in thinking through how do we stand that up more, really looking at models like shared services and how could we invest in those more deeply to support both family child care as we see more pivot to home-based care, and have those economic scales and effective business models, as well as some of those private, smaller childcare. And lastly, or not lastly, the data infrastructure, we really need more support for data. This has highlighted how hard and challenging it is. And then when I saw North Carolina's sites, which everyone will see in a few minutes, how jealous I was over some of those data systems out there, and what can we do across this country to have better data systems for all of us. And lastly, that cross-state national partnerships. Where can we unite? Where are there efficiencies across us? Knowing that some of the challenges are the same, even though things might be implemented locally. So last slide. that's it for me.
Okay, so thank you, Sarah. You know, I'm always struck when I listen to California, New York talk, coming from a state that, you know, or a hometown, I should say, of about less than 3,000. The numbers are just staggering here. I want to move on now to Tracy Gruber, who is from Utah. And I think, Tracy, we're going to turn it right over to you and try and keep this moving. So thank you for joining us.
Yeah, thank you so much, Linda. And just so you all know, I'm on a little bit of delay on my slides, and we'll just sit on the first one for a minute before we advance. I wanted to just provide a little bit of what's going on the ground in Utah, because we are different from what's happening in California and New York and some of the larger states. And before this started, we too were making some pretty solid investments in a child care quality system that was underway. The state of Utah established very early on a plan called Utah Leads Together, and it established 3 phases: an urgency phase, a stabilization phase, and a recovery phase for the entire economy. That morphed into thinking about recovery in terms of a dial, with red being kind of aligned with the urgent phase, orange moving on to yellow, and then eventually green. Right now, the current state in Utah is that we are at yellow, and what that has meant for childcare is that our protocols in our programs have changed dramatically in terms of health and safety and group sizes. And I just wanted to point that out because each state is so unique in how it's approaching this and the strategies that it's employing with childcare. And in some states, each county is different, which would be the case in Utah as well. At the outset and at the peak, we saw programs like New York's. I don't have a lot of data slides for you. I'm just going to talk through some of this. 40% of our licensed centers had temporarily closed, and about a quarter of our licensed families had temporary closed. At this stage with us in the yellow phase, we are now at closure rates of about 21% of our centers and 8% of our family providers. So like what Janice was saying in New York, we are seeing a larger level of comfort of families being in smaller types of care settings. And we are also seeing and very happy to see that a lot of our programs are reopening. We do know that some will remain closed. We were very fortunate and excited to receive the CARES Act funding like the rest of the states, and I just wanted to go through my and just quickly tell you what we did in our CARES Act funding, and then answer the 3 questions that were the title of this forum organized by the Bipartisan Policy Center. We did make very quick changes to our subsidy program, similar to what you've heard previously. We increased our eligibility threshold from 60% of the state median income temporarily to the federal maximum of 85% of the state median income. We don't know how long we're going to sit at that level, but felt that it was important to allow as many families that needed to continue to work to access childcare. We're paying based on enrollment now so that those funds can continue to flow to the childcare providers who accept childcare subsidies, keep them open and operating, also allowing the parents to maintain eligibility for childcare. And we've also started May 1st to waive co-payments for all of our families. So the CARES Act funding allowed us to do that pretty quickly and efficiently. Next slide, please. At the very beginning, we heard from our healthcare providers that there was going to be an urgent need for childcare for essential employees when the education system shut down in the state of Utah, which happened pretty early for a state of our size. Our schools closed by March 12th, and almost immediately we knew that we needed a temporary childcare system. Our lieutenant governor and governor quickly set up a child care task force that's part of our emergency command structure to build that system. And we leveraged existing child care providers that were temporarily closed. We asked them to reopen and only serve essential employees in extremely small group sizes that provided them with enough funding to pay their staff, make their rent, and serve these families. We felt that the group sizes was very important. Our definition of essential employee was very narrow. It dealt with the healthcare sector and also first responders. We have served over 300 children through that system at 30 sites throughout the state and contracted with 9 providers for some additional slots. And we notified families yesterday that that system will be closed at the end of June as we moved into yellow in our state. Next slide, please. Those were part of our urgency phase. We then moved on to our stabilization phase and wanted to stop the bleeding in the child care system. So quickly released what we called an child care operations grant that provided quick funding to providers, accounting for CARES Act allowable expenses. It also allowed us to help support them while any type of infrastructure on the PPP was coming through and for programs that were not able to apply for the PPP funding. Next slide, please. We are now thinking about recovery. So the stabilization phase was fully dealt with through these operations grants and allowed the providers to make decisions. We are hearing from providers. We did a survey about what their needs are to get them reopened and help sustain them. We know that in family child care, they need better business skills and access to financial coaching. So that's going to be part of our recovery. We know that a lot of our providers are going to have to make some changes in their facilities, given the group sizes and separation of children and cohorting of children and hand washing, and we're going to use some of our funding for them to make those improvements in their facilities. And then we knew through a partnership actually with the Bipartisan Policy Center 2 days before this all happened, we had just released a report about childcare access and the need for more access. This has set us back even further on that. So we know that we're have to partner with maybe our Chamber of Commerce and our Governor's Office of Economic Development and Small Business Administration to help people establish new child care programs. What I would say about the CARES Act funding, what worked, what hasn't worked, and where to go from here, I thought it was really amazing that it's clear that everyone understood the critical role that childcare plays in the nation's economic infrastructure. And the fact that there was designated funding for childcare critically important, and it came to us quickly, and it was incredibly flexible, and it's allowing us to address every stage of this crisis in the childcare industry. I think what didn't work is that the funding, of course, is going to be good for the next 3 months, but we are now realizing that this crisis isn't end at the end of June. It's going to continue for the foreseeable future, and the funds just will not allow us to go much further beyond the end of the summer. And what's next is stuff that I had already mentioned on our phase. Establishing that solid infrastructure for childcare so that if another crisis comes along, we are better able to weather it. I think providing clear guidance and technical assistance from Utah's childcare licensing and our partnership with them on how to adjust during these times for our providers is something else that's next for Utah. And then, of course, rebuilding our system and infrastructure in the future. And with that concludes my remarks.
Well, thank you, Tracy. That was great. We're going to keep moving right along to Ohio and Kara Wendt, who is the Assistant Director of Job and Family Services there. So Kara, we're going to go on to you.
Great. Thanks, Linda. If you want to move to the next slide, that'd be great. We're going to start with where we were prior to COVID. So in February in Ohio, our landscape looked pretty different than today. We were serving approximately 119,000 children in our publicly funded child care program. And we were doing that with just over 6,000 licensed programs. We had 3,880 centers and 2,404 family child care providers. For our publicly funded child care, and I'll focus on that for a minute, we average about $15 million per week in direct service payments. And that's just to give you a scope of how big this program is just on the public service side. When we were leaving the end of February, we were focused on Step Up to Quality. It was our quality rating and improvement system. We wanted to make sure every child had quality educational experience in a healthy and safe environment. And we had 91% of our programs participating in that program. Next slide. On March 9th, Governor DeWine signed an executive order to declare a state of emergency. On March 22nd, he issued, we had a public health order issued for staying at home. And on March 25th at 11:59 p.m., we actually closed all childcare. When we closed childcare, we obviously knew that there were going to be essential staff that were going to need that service. So we quickly stood up temporary pandemic childcare programs. These were still regulated programs. We did reduce and focus on the health and safety components. We actually stood up 86 brand new programs predominantly in or around hospitals to serve those essential staff. In Ohio, our essential definition really focused on healthcare, first responders, and those providing basic health and safety needs. We opened about 2,500 programs, and we are currently serving over 24,000 children. At that time, we anticipated a need of about 50,000 children needing care, and found that parents just weren't comfortable sending their children back to a congregate setting, and they found alternate means to support our programs during this time, because as the other states have mentioned, having enough access to quality childcare and ensuring that child is healthy and safe while the parents are at work is a critical component to the workforce. We knew that we were going to have to provide some support to those programs who just had the switch shut off as a closure. And as a result, because of the flexibilities that were afforded to us in the CARES Act and through the CCDF program and the funding through the CARES Act, we were able to provide closure payments to our programs that were serving our publicly funded children. Next slide. So when we stood up those temporary pandemic programs, we thought too it was going to be short-lived. We did not anticipate having to do that for approximately 9 weeks, but we did just issue an announcement that said we are going to reopen our child care programs on May 31st. However, they're going to look different than they did previously. And unfortunately, these differences are the focus of keeping not only our children, but also our professionals safe, but they cost money. And when we reopen on May 31st, we know that we're going to have child care programs screening our children, our professionals, and the parents dropping off. We also have increased hand washing and sanitizing. Those are regulations that we always had, and we had rigorous requirements around. But given the new landscape, we knew that we needed to increase those even more. Unfortunately, again, with that comes a cost. In addition to temperature screening and increased hand washing and sanitizing, we also reduced our class size. So in a room where we used to be able to have 16 children, we now can have 6. In a room where we used to be able to have 30 children, we now can have 9. We did that because we wanted to ensure that we kept our numbers as low as possible and really tried to adhere to the recommendation of not having more than 10 people in a room that were unrelated. Now, do we know what that's going to do from a prevalence or a communicable disease standpoint? We don't yet. As you can see at the bottom of this slide, we're actually undertaking a study to try to evaluate that. We're working with some of the Ohio research institutions, and we're going to try to look at the prevalence of and spread in childcare. One of the things we know that we're struggling with is having good data in this space. In addition to those other changes we've already discussed, we're also requiring our providers to not only notify the local health department if they have COVID positive test results or exposure, but also notifying our agency just as they would with any other serious incident or risk. So how are we going to support our programs during this time when they're experiencing reduced class sizes and increased costs? The two just don't balance well together. And fortunately, through the CARES Act funding, we are able to stand up a grant support that will actually provide 2 different levels of payment This was just issued today. It's hot off the press. We will have a COVID payment that is intended for our family child care providers in our centers and day camps and in-home aides, and they vary in range, but it will be to provide assistance in covering the cost of COVID-19 classroom dividers. So they may be able to put up a temporary barrier to have multiple groups of kids depending on the size. And then, oh, can you go back to the last slide? And then we're also to cover cleaning supplies and PPE, thermometers, and other expenses such as sanitizer. That's one portion of the payment. The second payment is to support our child care centers as a result of this reduced ratio and class size. We know that to keep our professionals healthy and safe, many of that we'll keep reduced class sizes, but we also know that some parents just aren't going to feel comfortable. So even with these reduced class sizes, we're not sure we'll have enough children enroll and enough need. It's really something that we're trying to balance. We did put a survey out to our providers last week. We got preliminary data that showed we had about a 35% response rate, which for a survey is pretty good, and 77% of our programs do intend to reopen, which is incredibly promising. The concern is still weighing out the parents and how they feel about truly sending that child back. Next slide. So you've heard about what's worked so far. I think we continue to learn as this environment continues to evolve. So far, we've provided the closure payments. We actually also covered the publicly funded child care children, those eligible for publicly funded child care. We covered their essential child care where our programs were closed. And then we're also providing that reopening grant support. Unfortunately, as I believe Tracy from Utah mentioned, we anticipate the CARES Act funding only lasting between 2 and 3 months, which we do not want to underestimate or not sound grateful. We certainly appreciate the commitment that was made to us, especially the fact that it was made early on. Unfortunately, we're hearing from some of our programs that they need the amount we're providing, so we can't extend it anymore, but they're concerned about what happens when that money runs out. They're concerned about opening their business, getting those children back in their rooms, and then having the concern of what happens in July or the beginning of August when we're no longer able to provide that grant support. So when we talk about ongoing need, we're looking at the stabilization support. What happens when the funding runs out? How do we make sure we can support our programs? We're hoping that we'll have that study back on prevalence fairly quickly to help inform us to see if we can adjust our class sizes. We'll be able to better evaluate where our parents are, but certainly know that there is need because unfortunately the overhead cost of these businesses didn't change and they're still trying to figure out how to make that work. And then as you've heard from my colleagues, the workforce support is going to be critical. This is already a field where the workforce was a struggle to find qualified individuals because it's low income, it's high activity, you're dealing with little kids all day, every day, which is rewarding, but also exhausting. As a mom, I can say that. And I think that the concern is just recruiting the right individuals to be in these positions and being able to retain them so you don't have a constant churn, because obviously consistency and stability is key to a strong learning environment, and adding and compounding the fact that this COVID world does take out a number of our workers because they're in the high-risk population. So everything seems that it continues to compound, and we're trying to evolve and evaluate as we move forward. So we're, again, appreciative of all that's already been done and hopeful that we can partner into those next steps.
Well, thank you so much, Kara. We're going to keep going because I'm looking at the clock and we do want to have some time for questions. So I'm going to turn it right over to Matt Judge, who's with the Department of Early Learning in Washington. Matt? Matt, we're not hearing you. Are you muted?
Can you hear me now?
Yes. Thank you.
Thank you. Thanks, everyone. I'll just follow loosely the slides that were provided. In the first one, early learning and childcare, I'm just giving an overview of sort of what Washington's childcare landscape looked like at the time that COVID-19 hit. We were engaged in a project of trying to stabilize childcare in Washington State, particularly with a focus on our subsidized childcare payment rates, which we'd made some substantial investments in. And those were going to our licensed family homes and licensed centers and licensed school-age programs serving families receiving subsidies. And then we also, Washington State is particularly reliant on a form of license-exempt childcare called Family, Friends, and Neighbors Care that are also subsidized childcare providers. And then, of course, we had our school-based settings. With the emergency proclamation that was made in our state on February 29, and then the stay-at-home order that was put in place in March, we went to restricting all child care settings to group sizes of 10 in accordance with CDC guidance. And of course, that had a pretty quick impact in terms of closures of licensed child care settings, particularly our child care centers that are serving the highest capacity of children in the state. So we quickly set up a data dashboard so that we could track our providers. And at a high point, I think we had lost about 30% of our licensed child care due to COVID-19. And we've been making efforts ever since to keep providers online that are still with us and bring providers back that we'd lost. Part of that was through granting waivers to certain licensing requirements and setting up kind of an emergency licensing regime where we were doing virtual visits and trying to meet providers halfway that were trying to come online or stay in the system. Just to talk specifically about what we are doing with the CARES Act funding on that slide, you can see that Washington State received $58 million through the CARES Act. And that money is all in a pool administered by our legislature. And we had been gearing up for what we thought would be a surge of COVID-19 cases that would necessitate that we focus on emergency first responders. And when that surge thankfully didn't hit, we pivoted and established a grant program to try to assist providers to stay in the business. And with just a few simple rules so that we could quickly get funds out the door. And we differentiated the grant amounts based on the provider's license capacity, with some of the smaller providers being eligible for a $6,500 grant, medium-sized providers eligible for $11,500, and then our larger providers serving 100 kids or more at $14,000. We received thousands of applications for those grant funds just on the first day that we opened the grant, and have received about 3,600 so far, and have already spent through $23 million that we of the $29 million that was set aside for these grants. So we anticipate that portion of our additional CARES Act funding will be exhausted rather quickly. We further have been made some changes to policy in our subsidized child care program and in licensing and in our background check requirements. Started that in March, and by the time we finish wrapping that up in June, I think that we will have likely spent through the remainder of any of the CARES Act funds. And a big portion of that you can see on the child care policy update slide. We eliminated co-payments in our subsidized child care program starting in March, and that'll go through June. And just that by itself is very costly and will consume many of the CARES Act funds, and I think we'll be exhausted by the end of June. You can see that we also relaxed the requirements for reauthorizing families. So if a family lost their job due to COVID-19, they could still reestablished eligibility in our subsidized childcare program when it came time to reauthorize their 12-month eligibility. So that had an expense as well. And then we moved to enrollment-based payments for providers, even for providers that had closed, so that we could assist them to stay afloat while families pulled their children out of childcare. Finally, due to social distancing, our fingerprint background check system couldn't operate as it traditionally had, and so we've moved temporarily to a name, date of birth background check that required a waiver of some of the CCDF requirements. And then in our licensing system, we've moved to remote/virtual health and safety monitoring, and are granting waivers to some of our licensing rules, particularly around mixed age groups, so that providers can sort of improvise their child age groups so that they can have a model that's somewhat functioning. But as we turn our attention to the summer and the fall, we really don't have a solution for how providers are going to stay solvent and have a working business model with the social distancing requirement of group sizes of no more than 10. That really hits the bulk of our childcare capacity, our licensed childcare centers, right where they live. And we've lost capacity to serve about 60,000 families, even after the grants that we're pushing out the door. So all that to say that the CARES Act funding, of course, was welcome and a needed injection at a critical time, but it doesn't provide us a solution going forward for how we're going to get the capacity back and what we're going to do when family demand increases as we try to get our economic recovery going. So I know you still have others to hear from, so I'll stop there.
Okay, thank you, Matt, so much, and thank you for going through those quickly. Next, I'm going to turn it over to Sarah Vanover in Kentucky.
Thank you very much. If you want to go to the next slide. So there we go. Thank you. In Kentucky, let me start by saying we have 120 counties in the Commonwealth of Kentucky, and 65 of those counties are considered child care deserts that have significantly less slots available in the child care system than the children who live there and need full-time child care. We have approximately 165,000 slots of capacity throughout the state right now, and our goal lately has been to maintain that and to increase it so that we could serve the children throughout the state. Of course, when the COVID pandemic broke on Friday, March 13th, the public school system closed down, and then child care programs closed down 1 week later. During this, our department at the Division of Child Care, we kicked into high gear, and there were several things that we altered. Our state plan for CCDBG funding was changed so that we could pay for subsidy based on enrollment and not attendance, so that programs that were closed could still continue to receive those subsidy payments in order to assist with fixed expenses that they would have even without the children present. We also filed a waiver with the Office of Child Care so that we could pay the parent copay fees, since many of our families who were getting subsidy may have then lost their job and not been able to pay for those expenses, and the centers, of course, still needed that funding. And during the time period at this, we also did an extension of recertification so that anyone who came up for recertification of subsidy during the time period that child care programs were closed automatically had a 3-month extension during that time period. Now, by paying subsidy and continuing to give those funds, that is 28,000 children in our state that receive subsidy, so only 17% of those slots were receiving funding at that point, and all programs needed funding to maintain during this mandatory closure. When we closed down the 2,285 centers, we had to open emergency or limited duration child care programs to serve our essential employees. And we had approximately 80 centers open during that time period. There was a total capacity of 6,000 slots and under 2,000 children enrolled. As several other states have said, we anticipated more need, but parents really looked for alternative solutions if possible. So not as many children utilized those emergency programs. That meant that only 3.5% of our centers have been open still at this point, and our definition of emergency responders in Kentucky was very limited, and it primarily focused on emergency responders or frontline DCBS staff, those types of positions. We were blessed to receive $67.74 million through the CARES Act. If you could move to the next slide, please. So the first thing that we did was we took 60% of that CARES Act funding and distributed it to centers based on capacity. So they received $225 per child based on their capacity. That was over $40 million of the $67 million. And I was so excited to be able to distribute that to our centers. I thought it would make a huge impact. And then I received emails back from them just saying, you realize that that's only a week worth of revenue that you're providing. We're grateful for it, but it really only provides 1 week of the support that we need. So we continued. We were very, very grateful for the flexibility in the CCDF changes so that we could support programs that weren't solely subsidy children. We did offer a $1,500 hero bonus to all 800 employees that were working in those limited duration childcare facilities. And we did pay the full amount of subsidy for children of essential workers that already qualified for subsidy, so that if there was any overage or copays that we took on that cost. If you could move to the next slide. Other things that we did, because our LCD programs were so, they had such low enrollment, we had to provide additional funding for them so that they could remain open to serve the children of our essential employees. So we gave them a stipend based on their capacity for $250 per child to make sure that they could operate during this time to serve those essential employees. And then the remainder of our CARES Act funding is getting ready to go out next week for restart funds to programs based on their size, whether they're in-home, a licensed program with less than 100 children, or a licensed program over 100 children. They'll receive money for cleaning supplies, for thermometers, PPE, and also for temporary walls if they are using those to place up and divide those group sizes moving forward. If you can go ahead and move to the next slide. So Kentucky has been closed this whole time, and we are preparing to reopen in June. Family child care homes will reopen on Monday, June 8th, and then child care programs, center-based care, will be able to open on June 15th. As part of our restart plan, we have limited group size to the CDC recommendations of 10 children per group, and that is going to cause a major reduction to capacity throughout the state. We're looking at a 10 to 20% reduction in capacity for infant and toddler care. Again, some of the hardest care to find, and we do have counties throughout the state already that do not have any infant toddler care based on our child care deserts. And then we're anticipating close to a 50% reduction in preschool care based on the fact that classrooms previously had anywhere from 20 to 24 children, and now they're going to have maximum group sizes of 10, depending on whether or not they can add temporary walls to divide that space. We did recently have a survey of up to, we sent out something to all 2,285 child care programs and asked them to respond on if they anticipated that they would be able to reopen. We had 85% tell us that they wanted to reopen. They were hopeful and they wanted to have that ability, but they're scared. They're scared of several different things. One is the revenue reduction is going to be significant based on the group size that we have placed on them to discourage the spread of the virus, but the providers are scared that they won't have the funding to stay open. The access to PPE and cleaning supplies has been an issue, as well as staffing. Many of our staff members throughout the state are at that at-risk health age or health impairment group, and so many of them don't want to return for their own personal safety at this point in time. We are looking at ways to continue to build the workforce right now. If a center-based program is going to close, then we're trying to recruit those programs to work in-home family child care programs to start their own business, and we're trying to help businesses work with a network of child care providers that they can refer their employees to, and then those child care centers can help make sure that those businesses stay open. But we are looking at a lot of uncertainty moving forward. The biggest concern is that due to unemployment insurance and the CARES Act, everybody was able to sustain so far during this 10-week shutdown and through June. But once they reopen, there's just more funding that's needed to create stability.
Okay, we're going to keep moving now to Todd Landry, the Director of the Office of Child and Family Services in Maine. And Todd, I turn it over to you.
Well, thank you very much. Happy to be with you, and thanks for the invitation. I guess it's time to hear from one of the small, considerably smaller states. I think we're the smallest state on this panel. On the next slide, you'll see a little bit about what our efforts to date have been. I'm not going to go through these in detail. Many of these mirror what you're hearing from some of the other states. As you've heard, some states closed childcare and then reopened for essential. Maine took the approach, as you've heard from others, about deeming childcare essential, and the decision to open or close was left to those individual providers. Saw a question in the Q&A about why some closed and why some remained open. And the feedback that we have received is some closed because of low census, or anticipated low census. Some closed because of their own concerns about health and safety of their own staff or themselves. And some closed because they were affiliated with a school or a K-12 school. And when the K-12 school closed, they chose to close as well, which was the case for all of our Head Starts, for example, in Maine. All of them closed in the state. Some of the other strategies you see there, very, very similar to what you just heard from Kentucky. I'll jump down to that second to last bullet point. About 45% of our CARES Act funding was distributed in April to all providers, whether they were open or closed. They received either a base amount of $75 per licensed slot, and then for those that remained open, they received an additional $100 per licensed slot in recognition of the additional costs that they were incurring. The implementation of subsidy for essential workers, and we left that definition really very broad, unlike in comparison to some other states, that is accounting for about 10% of our total CARES Act CCDBG dollars. So 55% of the dollars have been allocated or already distributed to either providers or to support essential workers. On the next slide, you kind of see what our tracking is as far as childcare closures by day from the middle of March. We saw, of course, this very rapid closure track in the first few days, in the first couple of weeks that we were experiencing our state civil emergency, and then a flattening, very flat through all of April and even into early May. Then beginning in May, as Maine began its staged reopening plan, according to Governor Janet Mills, we have begun to see a gradual reopening. So from a high of nearly 50% of our centers closed, we're now sitting at about 40% of our centers closed, with, we hope, many of them reopening in June. That's our understanding that many of them will, although some, such as the Head Start programs, have indicated that they will not be reopening until school starts up, our traditional K-12 school starts in the fall. On the next slide, this is how we're approaching our recovery and some of our guiding principles around that recovery. Very, very similar to what I think you're hearing from the other states. Using data to drive it, ensuring staff health, well-being, collaborating with our partners, and most importantly, protecting the most vulnerable in our communities. The next slide will give you more detail about what that staged approach looks like. So you can see where we are now in May is stage 1, and then beginning in June, in stage 2, we'll be encouraging telework for our staff, but begin rotating staff back in the office. We will end or plan to end our temporary emergency licensing program. And then the last 45%, the last of our money from the CARES Act, is gone by the end of June in the provision of these CARES Act recovery grants. Again, very similar to what you just heard from Kentucky. We'll be providing those to all centers and all providers, family or center-based, either open or reopening before the end of the month of June. So as of the end of June, we'll be out of all of our CARES Act money, but based on the feedback that we've been receiving, we need to get the dollars out to support the providers as much as possible. And then you'll see stage 3, July, August, and stage 4 will begin to move back to whatever our new normal is going to be. I would simply say, in keeping with the theme of this call, I'll give you my perspective on what worked, what didn't work, and what's next. What worked, in my opinion, was the flexibility of the CCDBG CARES Act dollars. Each state knows better than any other individual or any other state what they need in their own state. And so providing that flexibility, I think, was absolutely critical. The other thing that I think worked is the flexibility of each state to decide what was the best approach around supporting essential workers and supporting childcare in their state. Some closed and reopened for essential, other left that decision open to the providers with restrictions or parameters. Keeping that flexibility for the states, I think, is absolutely essential. What didn't work, I will tell you what did not work in my view, was the fact that in some cases with the coronavirus relief bills, increases in unemployment, we had situations where when people did the math, it was better for them to go on unemployment versus continue working in their child care program as a teacher or as a staff member. And that did drive some closures by some of the providers because they were trying to do what was best for their employees. So that was an unintended consequence. I don't think anyone planned for that to happen, but sometimes those unintended consequences have pretty significant ramifications. The other thing that our providers would say didn't work is while the support was appreciated, and you just heard this from Kentucky, it wasn't enough. A lot of the support that we put out, similar to Kentucky's experience, was enough to maybe cover their revenue or part of their revenue for a week, maybe a little bit more than a week, but it simply wasn't enough to sustain many of them from those perspectives. So that was a challenge. And last, what's next, I would say, is if we are truly interested in restarting our country's economies and our state's economies, we cannot do it without available and quality childcare. It is the only way that we're going to be fully able to restart our economies and get our economies moving again and begin to try to offset some of the massive state revenue reductions that we're seeing. And so as we look to those recovery pieces, I think we've got to look at how we can support childcare effectively and how we can provide the states some additional resources and flexibilities to assist those childcare providers to be able to enable their parents to return back to the workforce and get our economies moving again. With that, thank you very much, and I'll turn it back to our moderator.
Okay, thank you, Todd, and thank you for being brief there. I'm going to keep moving here and turn it over to Susan Gale Perry from North Carolina. Susan?
Hi, everyone. Thank you, Linda. Thank you to the Bipartisan Policy Center for organizing this. I think you all have heard from many of my colleagues across the country, both about some of the similar ways we've been responding and some of the differences in our state. So if we could flip to the next slide quickly, I'll try to go very quickly. There are a few things about North Carolina, like every state, that are unique. We do have a Smart Start network, which is a public-private partnership. In addition to our Child Care Resource and Referral Network, we do operate a statewide pre-K program, and we have a quality rating and improvement system that is fully embedded in licensing, and a state law that allows child care subsidy only to pay for 3, 4, and 5-star ratings. And it's helpful to know that context when you think about our response. We have about 5,700 licensed child care facilities. North Carolina is a state that has way higher percentage of centers and family child care homes, as you can see, and about 41,000 teachers and staff. And on the right-hand side of this slide, I think you can see North Carolina is a state that did not close child care. What we did do is require child care programs to meet certain health and safety guidelines and apply and register. We also require that they only serve essential workers during the stay-at-home order, which has now been partially lifted. You can see that we have a steady increase in the number of programs open and the number of children attending childcare, but we are still looking at vacancy rates overall of around 68%, with 62% of our programs open. And as you can see, a much greater percentage of homes have remained open with lower vacancy rates than childcare sectors throughout the COVID-19 crisis. So I'd like to pause on this slide just for a second, because in the consolidation of slides, we lost a slide about North Carolina's response. And just as I'm impressed by my colleagues around the country, I'm proud of the things that North Carolina has done very quickly in 4 primary buckets: health and safety, access and affordability, operational support, and then workforce support. So we did establish health and safety guidelines. We did stand up a network of childcare health consultants to work directly with childcare programs and consult with them on their issues. We also launched a hotline for families to access enhanced childcare referrals if they were essential workers. We've covered the co-payments for childcare subsidy for families for April, May, and June. And we stood up an emergency childcare subsidy program that has served over 17,000 essential employees in April, and we're also going to continue that through May. In the operational support area, we provided subsidy stabilization to all programs for April and May, and now for open programs in June. We also stabilized our pre-K program, which meant that we were paying at pre-attendance levels, pre-COVID levels. And we've also provided operational grants based on fixed operating costs that are scaled based on the size of the program, the quality of the program, and the subsidy density. They didn't have to apply for those grants. They were just operational grants that we issued directly to them. And we are planning to offer recovery grants in the month of July, at which point our $118 million in CARES funding and $47 million that we also had in prior year CCDF funding will be fully expended. And lastly, on workforce support, we did provide bonus payments at about time and a half for teachers of $950 a month for full-time employees, and teachers, and $525 a month to all other staff in the childcare program beyond teachers. And we also added on top of that an additional payment to address payroll taxes. We also launched a mental health hotline for childcare providers, actually, to consult on their own mental health, but also on the work that they're doing with children in their care. And that hotline is still operational. And we are planning incentives for teacher rehire in addition to the teacher bonuses. So if we could move to the next slide quickly. I think the next slide is illustrative of what my colleague in Maine was speaking of. And what I want to point out is that while North Carolina provided, relatively speaking, higher levels of teacher bonuses, it is still significantly less than what teachers who are on unemployment are earning in North Carolina. So you can see there that just, for example, the average monthly salary for a full-time teacher with the bonuses is $2,860, but for those of them that are currently on unemployment, they are earning $3,553. So that is the hard data that shows the significant difference, and part of why it's going to be challenging to reattract childcare providers to the workforce at this particular time. So we do believe there's a need for additional financial support. It is a costly venture, but it is very important and very worthy. And I think we're going to need that over the next several months in order to attract back the kind of workforce that we're going to need. Next slide, please. The other unmet need that we see beyond the CARES Act funding that we currently have, and North Carolina, like all the other states, are deeply grateful, for the amount of the money, but also that it came relatively quickly and did provide significant flexibility. Hope that should there be additional support, which we really hope for, that it will have the same kind of flexibilities in it, because it made it possible for us to move quickly and get help out there. You know, there's a lot of ways that you can look at lost revenue, but I wanted to actually put some real numbers to it with some assumptions. And granted, you know, we are making assumptions. So, and again, just acknowledging, caveating that there are a lot of assumptions here. I just want to point out that for programs that are closed, and again, currently just under half of our programs are still closed, we are able to do a pre-COVID revenue estimate of about $98.1 million per month. And even with the subsidy stabilization that we provided as an offset, there's still an $89.6 million per month in lost revenue, because we know that most revenue for childcare comes from private pay parents. So we just made an assumption based on all of previous research work that about 70% of costs for closed programs might have been offset because of staff layoffs. So they're not paying staff, granted. But even with that, you still have a $30 million per month loss in revenue for our closed programs. And then interestingly, on the open programs, and I hope that we're going to fix some of this with our upcoming recovery grants, you can see, in fact, even with subsidy stabilization and the operational grants that we have already issued, assuming that most staff are working, and we know from our daily surveying that they are, so there haven't been a lot of layoffs in our open facilities, they are still operating at a $45 million per month loss collectively. So the revenue loss is very, very significant. And this is why we do believe we're going to need fixed operating grants for at least 3 to 5 additional months beyond July to help them get back on their feet. And then finally, in terms of unmet need, and that's the next slide, please. I do want to talk about financial assistance for families. I don't have good data yet on this because we're just seeing it ramp up, but we're already seeing a significant uptake in subsidy applications. We already have a waiting list of 14,000, which is low for North Carolina. It's often 40 or 50,000. And so families who are now unemployed are not going to be able to access child care subsidy because there's so many families in the queue in front of them. We're also winding down our emergency child care subsidy program, so for all those essential workers. So we are very concerned about a pathway to continue to help families with child care expenses as the workforce slowly ramps back up in this economic reality. So with that, I will stop. I'm happy to answer questions when we get to that. Thank you, Linda, for the opportunity.
Thank you, Susan. I think we're going to keep moving now with Teresa Hawley in Illinois, and I know Teresa's got quite a few slides, but promise to go quickly, right, Teresa?
Yeah, no problem. And actually I'm going to skip over a whole bunch of it because it's very similar to what other states have done. So we can skip this. This just is background of our system, and go to the next slide. And just to let you know, we are one of the states who did choose to do an emergency childcare system. So we did close our licensed childcare centers and homes and then stand up a new system that had about 25% of our childcare centers participating in about half of our homes. And you can go to the next slide. We used our CARES Act child care funds in very similar ways to the way people have been talking about here. One thing I will highlight that we did maybe a little bit differently that I haven't heard people highlight before is that we did use some philanthropic dollars to do aggressive outreach and technical assistance to child care providers to apply for and receive the Paycheck Protection Program and pandemic unemployment assistance if they were home child care providers. And we think that made a big difference in the ability of our providers to make it this far. We all of this funding that we're going to do is going to run out, like everyone else is saying, by the end of June. What was difficult for us was because we use the Paycheck Protection Program really is one of the parts of our suite of strategies to support providers. It then became really difficult to navigate that along with paying for all eligible days in the child care assistance system. So because so much of our child care assistance comes from state general revenue, and you may have heard that Illinois is broke, we are really trying to make sure that we weren't paying people extra with the child care assistance program if they were already fully covered by the Paycheck Protection Program. But as you can imagine, that's pretty much impossible to explain to providers and has caused a bit of an uproar and has been a challenge for us to administer. So having some of the money come through a business support side and some of it come through child care assistance has actually added layers of complexity that have made things difficult for us. That said, I'm going to tell you about how we're going to use business support as our primary approach moving forward. Because in the next slide here, as we reopen our child care programs, we recognize that the challenges are facing all providers, not just those who are providing subsidized care. And like many of the other states here, we are requiring lower group sizes, and we know that's going to lead to significant losses of revenue for programs. We expect those lower group sizes to be in effect until there's a vaccine. So we're not talking about a couple of months of support. We are looking at least another state fiscal year of support. And the next slide, just putting some numbers to that so you can kind of see what we're talking about. These are the group sizes that we're going to have as we go into what's called phase 4 of our reopening. We're starting phase 3 tomorrow, but expect to be in phase 4 in July for much of the state. The capacity of the system down by about 25 to 30%. We think that may meet the needs of families because there will be lower enrollment we expect anyway, but revenue down by about 30%. And we've done the cost modeling similar to North Carolina to see how much centers will go into the red if they are faced with these kind of lower group sizes. And it's not an understatement to say that we fear the full and complete collapse of our child care system, and that the vast majority of child care centers faced with this will actually just close their doors and not be there to serve families on the other side of this pandemic. So what are we doing about it? On the next slide, our approach is to provide grants to offset the lost revenues for providers. We know that we're pretty much out of the CARES CCDBG money. I'm incredibly grateful to our state legislature and to Governor Pritzker that they saw this as a huge priority. And so with our coronavirus relief program in the CARES Act, these are more economic relief funds and state relief funds, we are dedicating, and I have an update to this, it's actually $282 million specifically focused on childcare. So of our small business relief program, at least 50%, and that's another update, of all that small business relief money that's being appropriated is going to be dedicated to childcare. And that was in the state budget that was passed this past weekend. We're still figuring out exactly how that works, but it's going to be grants around the order of $2,500 to $3,500 per classroom per month for as long as we possibly can make it happen for providers, and we're still figuring out the amounts for childcare homes. So we're super excited about that. It's not enough though, and on the next slide, I'm not shy to tell you how much money we need in our modeling. We think we need to get it to the end of June 2021, another $385 million on top of that fund that I just talked about. We know we need money for supplies and facility modifications, and we know we need money for workforce support. So on the last slide, we figured we need another $715 million in child care support that would best go through the CCDBG, and we would receive that in Illinois if the federal investment was at least about $20 billion. So whirlwind tour there, but that's what we're thinking from Illinois.
Wow, thank you, Teresa. That was great. That we're moving to our last person. And just so for those of you who are on and watching, we are going to let this run over because we do want to take a couple questions. We've had a number of questions in the chat function, so we will take them. So I'm going to turn it quickly over to Samantha Treeworthy. I always stumble over your name, Sam, but from Massachusetts, who will be the wrap up on this. So Sam.
Absolutely, and thank you all for having me and for bearing with us as we all explain our own situations. I am having technical difficulties today, so you don't have slides or my face. I'm feeling good to be wrap up in that way, and I'll keep it brief and echo many of the things that my colleagues from around the country said. So to give you a sense of our program in Massachusetts pre-COVID, we have about 8,000 providers, 8,200 providers, about 6,000 to 6,200 are family child care providers. The rest are centers. And of that, the interesting part is that's about 250,000 slots. We have about 750,000 children of working families in that age range of birth to 14. And so when we look at that, our supply and demand was already pre-COVID an issue we were trying to address. However, we've subsidized about 55,000 of those slots. So as we went into COVID and tried to understand the COVID crisis and tried to understand the impact this would have in our programs, we did an analysis of understanding how that 20% of subsidized slots in our system were distributed. And we found that about 50% of our providers of that 8,200 actually did accept at least one subsidy child, but only about 15% of our programs were subsidized at a rate that would sustain them on subsidies alone. So about 15% of our programs are subsidized at 2/3 or more level, making us very vulnerable to the private market and what was happening to private tuitions mixed in with our subsidy program as we headed into the crisis. So we are one of the states that did close childcare. We closed childcare March 18th and did immediately launched an emergency childcare program, and much like you heard from my fellow colleagues here, launched a separate program that ran independently. This allowed us to do two things. One, it allowed us to continue to pay our subsidies, including our parent fees through the closure to our subsidized programs, making sure that at least our budgeted money wasn't their impediment to stay open when we got to the other end of the crisis. It also allowed us to do specific stipends to our emergency care providers. We have about 530 that we're running continuously. As we've started to do a few phased reopening strategies, we've recruited about 20 to 25 more and continue to try to fill in a few gaps around the state. The interesting part about our 550 programs that are running under our emergency childcare represents about 7 to 8% of our system that is up and running, about 10 to 11,000 open slots that would be available. And we have yet to reach 50% of fill rate. Now, that is not true across the state, but it certainly is, on average, seeing very low demand in our emergency childcare. And while we have pockets of high demand, we definitely see more in family childcare, smaller group sizes. And we have not put a lot of restrictions on our emergency childcare program because it's so small. We have been able to monitor it on a daily basis with individual calls and supports as needed. And so it is not a capacity issue, but it is certainly a demand issue that our emergency childcare targeted to both essential workers and vulnerable families is not seeing a fill rate that would be sustainable without this separate program. So I won't dwell on too much on that. Happy to answer questions as they come, but focusing a little bit to wrap up on what is our post-COVID plan. We have just launched in the last 2 weeks a phased reopening of the economy in Massachusetts. Like our colleagues in New York, we certainly have been hit very hard by the COVID crisis, and our numbers are slowly improving. So we are starting to look ahead to what reopening of childcare looks like. I want to echo just, I think, of what a lot of my colleagues here said, that while we are looking to try to mitigate the impact of our policies on programs' finances, we are looking around at our colleagues around the country and know that even if we are able to open at full capacity like North Carolina, or at modified rates like Illinois, modified ratios in Illinois, regardless, the struggle of parents demanding this is going to really jeopardize our overall system unless we carefully think about our process forward. And so we have been trying to do some initial analysis of who we think are coming back into the field and where we can best spend our CARES money. We were lucky enough to have in our budget the funding that we were able to put out to the field during the closure, and so we're able to target our CARES funding to reopening. But like many of the states before me said, we're anticipating that it will take us a portion of, it'll fund portion of our programs through potentially the summer, but that we intend that we will need longer term solutions if we are going to sustain our programs. I think in Massachusetts, as I started with, given the mix of private pay and subsidy, we are incredibly vulnerable to the private pay market and families who are opting out of childcare. And so our colleagues who are seeing very low enrollment rates certainly are alarming to us as we think about moving forward to trying to run a system that functionally works on a per child per day model. And while we look to change our subsidy rates of moving to enrollment instead of attendance, things like that will not disincentivize good public health behavior during the reopening period, we know that private pay parents also struggle with the same type of realities and don't have the state subsidies and make up almost 80% of our market. And so as we've been thinking about this, we've been targeting our grants and looking through not only the business supports, like Illinois, we aggressively pursued technical assistance for our programs to really think about what other, besides our CCDBG funding, could be available to them to help sustain the industry during the closure. But as we look forward, we've been looking at the numbers and trying to spread that $46 million as far as possible to sustain the field. So just to give you a scale of our numbers quickly before I wrap up, we anticipate that we are about a $4 billion industry in childcare in Massachusetts, and a childcare market that has been losing through the closure from just private pay tuition about $250 million a month. So as we look forward, we've started to look at a strategy that would help us understand how we mitigate the risk of coming back into the market by supporting fixed operational costs for our programs, which run about $30,000 per classroom or per family childcare and don't include staffing or anything along those lines that are needed to serve kids, but are risks that our providers would be taking on for the year if they were going to come back into the market and didn't have children enrolled. And so really thinking about that work, we are looking at and this assumes, again, like my colleagues, making lots of assumptions to try to project what is needed. But this definitely assumes that there is a ramp up and not everyone comes back at once. But we're looking at about $450 million would be just the fixed operational cost that this industry is taking on if it ramps up slowly over the next 6 months and it sustains itself through the year. That doesn't have to do with workforce or anything along those lines. So you see, when we're trying to understand spreading the $46 million and helping it make it through the first couple months through a phased recovery, still seeking those longer term solutions of how we can sustain operations as family demand ramps back up. And most critically, like my colleagues here, also recruit the workforce back in, because in a childcare market, it doesn't work if you don't have humans to care for children, and all of that is well and good. We put a lot of money into bachelor's degrees and associate's degrees and child development associates over the last 5 years, and are really looking to see, as we work to sustain our programs, how we also do not lose our most qualified staff to other opportunities, particularly as we look to the fall and see that K-12 is going to have a very different kind of engagement with children, and want to make sure that our early childhood programming and our childcare programming aren't left without the qualified staff to be able to really make sure kids are entering the school system and sustaining the learning that we know we're trying to mitigate the loss from the last few months. So with that, I will happy to answer more questions, but I will wrap up and let us get to the question part, Linda. Thank you.
Okay, well, thank you, Sam, and thank you, everyone. That was a lot of information on that. I just want to say before we get into the questions, the first question is always, will this be available? And yes, we are recording this and it will be up tomorrow. So hopefully people who missed any part of it can have an opportunity to hear it. There was so much information in here and I really appreciate the expertise and just the scope of what these folks have pulled off in these states. We're going to keep going here for a few minutes. I do want to give the states an opportunity to talk about a couple of things. In looking at the questions that have come in, there were several questions. I want to clear the deck on one of them. There were several questions about Head Start, and of course, Head Start is out of the purview of the state folks. It's a federal to local, as we know, and so there were a lot of questions about why is Head Start closed. We will try to work with the administration to clarify some of the issues around Head Start as we move forward. So with that off the table, the second question that came up over and over again in the chat box seems to be around family child care. And what are we doing with that going forward? There was a lot of questions around family child care receiving subsidy grants. Are states supporting networks to support providers? Questions like that. So I want to give each of you one quick hot second to talk about family child care in your state. So I'm going to go back and start at the beginning and go through this roster and see. I'm going to, hopefully I am. Starting with Janice, are you still on with us? Can you talk about that just for a hot second?
Yeah. We're really looking at a lot of strategies for how we might support family child care because it's so obvious, and this was reinforced by my colleagues, that it's in many cases, the go-to modality of choice for many families. So we do not have a statewide network, a network of family child care networks, but we are looking at how might we think about copying some of the best practices in other parts of the country, including Massachusetts, and borrow some of those ideas and adapt them to New York. What we have seen is, until recently, a growth in our group family child care, the capacity of which can go as high as 16 children if 4 of them are school age and there's an assistant. But our numbers depend on the number of infants because you can't have there has to be a 1-to-2 ratio. Now we introduce group size. I did not talk about that in my presentation, but it is something that we have been looking at very seriously in New York because it affects family-based as well, and could have a serious impact on family-based care capacity, in addition to what we've already been seeing and project seeing in centers. So it's an area where I think good sharing, data sharing, and strategic idea sharing would be most welcome.
Okay, thank you. Sarah, how about you? What are you doing in California on this one?
So I think similar to what people have shared so far, we have definitely seen more centers close than family child care, although family child care also did close. They're all coming back online now. We do have some of our direct contracted programs have a family child care home education network that provides supports to those. So those fetchins really wrap around and support the family child care. And through that, there's a little bit of shared services, but I did share in mine, we've poured tons of training into business practices for family child care. And I feel like that's just an open sieve that we'll keep pouring things into. And really, we need to let them focus on the children and the families and what they do well and support them more through things like shared services. So that's off their plate, especially if we do have to go to more home-based care that's closer in communities, and also supporting them additionally in supports through a QRS and quality counts so that they do get wrapped around with coaching and supports on trauma-informed practice and other things that they might need during this time.
Okay. And others on
Linda,
this?
Could I just do one more thing? This is Janice in New York. I didn't mention that we sponsored webinars for home-based providers and others, but primarily geared to home-based providers, to access some of the loans made available through the Small Business Administration. Targeted strategies for home-based providers would be tremendous. I mean, there's a lot of controversy about those loan programs, but also a lot of potential. So we had about 7% of our home-based providers successfully access PPP, and we know many more could have. So I would just like to put that on the table as a recommendation.
Okay. Anyone else who wants to jump in on this one?
Linda, this is Sam. Would you mind if I jumped in quickly?
Have at it.
So we are in Massachusetts. So in full disclosure, I've only been in Massachusetts since August, and I grew up here, but just moved back for this job. So I didn't create this. I'm about to talk about, but about 75% of our providers are family child care providers. We've also lost in Massachusetts, much like the rest of the country, 30% of our family child care providers over the last 4 years. And so while we are so reliant and we're looking at them going forward, this support network is key. We have family child care networks that have been developed in Massachusetts, but I don't know as if we've incentivized them with the right kind of activities to do that shared services. They're based on enrollment and paid through our subsidy system. And I think that as everyone's talking about, what we're making the shift for going forward is how we move those networks, not just to help them with enrollment and processing of subsidies, but actually with these business processes that we know people really, really are going to need to address, because the entire business practice for early childhood has really been based on full enrollment, and that is the one thing I know we've all talked about is going to be a struggle for us for the next year. And but yet family child care is a place where if we don't have availability, parents may have nothing. It's more flexible for the work schedules that are going to be there, but our family child care providers are most vulnerable to the business end of this because, as Sarah just pointed out, they don't necessarily they didn't get into the business because they were savvy business people. They got in it for children and families. So we're looking to really target that strategy as we go forward to make them sustainable.
Mm-hmm. I will give a shout out. I don't know if Beth Bai is on this call, but Beth Bai over in Connecticut has actually used, I think, some of their CARES dollars to incentivize more networks in the state of Connecticut. So I think there are things out there that we can all explore. Does anybody else want to jump into this one? Because I wanted to get to one last question, but I really think this is an important topic.
This is Sarah in Kentucky, and we have really made an effort. In the past year and a half, we have focused a great deal on family child care homes, and we're using research and development grant funding to back that up. Several of the things that we've been looking at, we have 5 pilot projects running throughout the state right now that are focusing on different areas and what their needs are. And again, a lot of business practice training, a lot of shared services models. Sometimes it's cultural groups talking to different cultural groups about family child care homes where they feel more comfortable as opposed to in center-based care. But some of the things that we've been working on right now, again, as child care centers are contacting us and telling us that they're closing, we are reaching out to the staff at those centers and explaining to them what it would be like to be a certified family child care program, and trying to recruit those people who already have background checks, we know they love children, we know they know best practice, and we're trying to help them establish their own business, not only to preserve state capacity, but also to create those smaller environments that parents are looking for. We've also worked a great deal with our Kentucky Chamber of Commerce. And as many large businesses might have an on-site child development center, we're trying to work with smaller businesses to set up a network of family child care homes that they refer their programs to. So if a smaller business, based on the need, once they survey their parents, they might have 4 or 5 family child care homes that they recommend through their HR office. These are programs we endorse. You go to there, that will help those programs fill up their enrollment so they are sustainable. And then in turn, the employer knows that their employees are more likely to come to work because they have consistent and stable childcare. So right now, as we rebuild, we do have a recovery plan specifically for family child care homes in our state that those 5 pilot groups are working with and trying to recruit in their areas. But we are looking a lot at that business partnership with smaller businesses for family child care homes, as well as recruiting child care providers immediately as centers close.
Great ideas. We need to do something more with this issue. I can tell that. So one of the things I want to do, because I think if we need to wrap this up by 4 for sure, and we're over. I wanted to do a kind of lightning round of this. You guys all have an open mic here, and just pretend you have the attention of everyone in Washington, D.C. What do you want to tell them that will help you moving forward? Not what's gone wrong or any of the rest of it. What would help you as we try to move into recovery and stabilization of childcare? So let's start in the middle with Matt.
Well, I think that clearly we're going to need to make additional investments if, licensed childcare in particular is going to be viable in the states. And I should say that in Washington State, the context was already that we were seeing a dwindling number of our licensed family childcare providers. And a lot of that was going into our licensed exempt family, friends, and neighbors providers who aren't a part of our quality framework. They bring different qualities to the table, but I guess what I'm trying to get at is that if the investment isn't there, then the continued support for quality won't be there, and that's what drives academic achievement and ultimately economic success for American families. So the investment is not just to maintain the business, but to continue to push forward economic success for families.
Great. How about Sarah? Neville Morgan. I know we have several Sarahs on here. There she is.
Hi, and I'm so sorry. I was juggling something, and so I'm probably not your best person. Or Linda, you can if you could repeat it, because I had you on quiet, so I didn't hear everything you said.
Okay, I know I usually am kind of noisy. So no, the question was, if you have open mic night here in Washington, D.C., and you can tell people here what one thing would help you do this as you move forward, help you more. And I think we should take money off the table, because you can say money, but then go on from there. What else? Money.
We're always going to say money, right? Like there's no question that we would always want more funds, but I think you're asking for what should those funds be for? Yes. And I think I'm torn between the need for a universal early learning and care system where subsidy is part of it, but there's a sliding fee, and really standing up this as a public good, knowing that you can't have a working America without it, and really coming to that realization of how do we put in place all those pieces. And then knowing that we do have a mixed delivery, how do you wrap around and really fully support that mixed delivery? And so investing in, for all the states, a shared services model where they can upload that. And then I can't give you one. And then saying that we really need strong data. And some states, I think, have been able to move that forward, but a lot of us are still struggling. And so what national investments can be done around strong data to help support us as we move forward and be able to give you great charts and information, really quickly do data queries for all of this need. But that national or that universal early learning and care system is so needed as a public good. And how do you create this so that those people in it would actually get funded and have salaries that make sense to go into this field and have the quality that we need to fully support our young children?
Okay, doke. Thank you. Okay, how about the other Sarah Vanover?
Okay, so I think one of the key essentials here is we have to get everybody.
Oh no, Kentucky, I'm sorry.
Yes, this is Kentucky. So one of the key essentials is to look at long-term perspective here. And I know that right now we're thinking, many people are thinking, okay, so if there's not a great need for childcare over the next 4 to 5 months, why do we want to invest there? But often when we look at other industries that need bailouts, like the aviation industry, we're not worried about the next 3 to 4 months. We're worried about what's going to happen if the aviation industry were to fold and what would be the long-term impacts. Right now with childcare, we have got to look at the long-term impacts. We've got to give supports to this year so that it will be there for many more years to come, because our workforce is dependent upon childcare. And as a working parent, I cannot do my job if I don't have that support. And there's so many of us in that boat. So instead of focusing on these next 3 to 4 months and say, well, we don't, there's not a high demand, we don't necessarily need to worry about whether business is closed or not. We've got to look beyond the next year and say, this is something that must stay in place for a long time.
Thank you. Very nice. Todd, how about you?
Yeah, I would say one thing that this, I think, has pointed out to us more than anything for me is money and the flexibility and the direction in the future to move from a per student, per pupil funding model to much more of a provider model that supports supports that entire system of ages and provision of service. Many of us have pointed out the challenges that are inherent to the per pupil model when you're in a situation like this, and yet you still need that essential provision of care, even though it's a fewer number potentially of students in the census. So moving away from a census model to more of a programmatic support model, I think, is going to be something we have to consider for the next several months and possibly years.
Thank you. Great. How about Susan Perry? Is Susan on?
She had to leave.
Oh, okay. Teresa, let's go to you.
So I would say, we've talked for 2 hours here about childcare, and we've essentially never mentioned early education. So I think remembering that we can't divorce education from care, and understanding that our childcare system is our early education system. I sit in a different kind of place now where I'm across the entire educational spectrum from birth through college. There isn't anywhere else in the educational spectrum where we don't invest in the infrastructure and where we sort of leave it to chance about what kind of services are going to be out there and available for families. So recognizing that children under the age of 5 need education all the time, regardless of whether their families need childcare, and that this system needs to be built and supported in order to provide that.
Oh, great. Thank you. How about Kara? There she is.
Sorry about that.
There you go.
Very quickly, I would echo what Todd said around flexibility. I think that's going to be key long term, but even more so in the short term as we learn what this really looks like over the next few months. I also would say any way that we can do or provide workforce support. So recruitment, retention, but also just recognition of the importance of this field. We've certainly heard the criticality of having quality childcare and needing it for our it's an essential service. Now we need to carry that message forward, not just in the time of a pandemic, but ongoing. So those are my wish list in quick order.
Thank you. Okay, Tracy.
Yeah, echo what has been previously said. I think recognizing that the financing model for childcare is not sustainable and families can't afford it anymore. And knowing that it's a critical part of our economic infrastructure, both short-term for families now and our future, is very important. In terms of COVID-related, I think it's important to know that this is not a short-term crisis for childcare. I think at least for some of us, we entered it thinking that it was like a 2 to 3 month situation. I don't think we're going to get back to normal in child care for many more months to come, and our child care providers are going to be in jeopardy of closing as long as there is no vaccine.
Mm-hmm. Okay, Janice, how about you?
Well, I actually have some visuals in my mind. I mean, what we've been experiencing is really scorched earth, whether it's tornadoes, fires, volcanoes. It's really knocked flat our child care system and revealed, as many have said, the vulnerabilities that have been there all along, but now they're being held up in stark relief. In the short term, it's watch the gap. You know, I think that the things that states have been doing, the stipend programs, the stabilization grants are what has to happen right now. Longer term, and I like Sarah's, got to keep your eye on the long game. We've got to really take this crisis and turn it into an opportunity. Mm-hmm. It's a rebuilding moment. And collectively, we can't let the opportunity pass. And I think we can look north of our borders to Quebec, the Quebec model, when they moved towards universal child care and the impacts that it had not only on maternal employment, but also economic revenue that went into the city and the province. So this is a moment. We can't let this moment pass and just let it wash over as a crisis. But really look at the model of natural disasters. The Earth comes back in new and different ways. How can we do that with childcare?
Okay, thank you. And I think, Sam, if you're still with us, we're going to close with you.
I am. So yeah, thank you. I want to echo what all of my colleagues said, and I think that we have similar challenges, all in our unique context. And I think that I would echo flexibility and really investing so we all can invest in the kind of infrastructure and sustainability of that infrastructure for childcare for the long haul. And as you've just heard, all of us have a little bit of a different construction, oversight body, all of that. So that flexibility is key, but with the not linked to children, but linked to the kind of program sustainability that will get us to the long haul. I think that also is about really sustaining the workforce, and I think bridging what Teresa had said around Illinois and thinking about the early learning. The thing about education and the flexibility we need to invest in the infrastructure and invest in the sustainability is really also making sure that that our humans are there, and that is going to take a qualified workforce and is going to take flexible investment to making sure that that we are getting highly qualified people back in, and we are not then just looking to any adults, because we know that that's not what drives child outcomes, and that won't be necessarily the best investment in that infrastructure over the long term. So really thinking about sustaining the infrastructure and then sustaining the workforce simultaneously to be able to be both the workforce support and the educational support. And then I would be so remiss if I did not also put a shout out to what Sarah said on data. I've had working in multiple states now. The data infrastructure in early childhood does not allow us to move with the nimble quickness that we know we are going to need. And so knowing that this is not a state-by-state issue, but it really is a universal issue, and that in order to best make the best decisions in crises like this, that we need not only the flexibility, we need not only the infrastructure and the humans, but the system needs the capacity to analyze and pivot and make the best decisions possible. And so I think those three things are what I would focus on.
Oh, great. Thank you. Well, that's a great way to summarize all of this. I want to read you all one thing that is in the chat box about this. And kudos, and here it is. And let me just say that I've gotten personal emails, texts. I can't tell you how many people saying these people are amazing. And this one came through the chat box, but kudos to all those amazing administrators for putting together such a clear data and describing the state of childcare. I cannot tell these people how much I admire and appreciate them, and I feel for them in terms of how much they have put into this over the last couple of months. And as we started out by saying, in uncharted waters. So my thanks to the 10 of you for joining this, and for all of those who have questions. We will try to summarize some of the questions that we can over the next week or so, and get back to post something in terms of where we can answer some of these questions. We had a lot of questions come in through the chat box, and I think that there was a lot of interest in what you all had to say. So again, appreciation, and thank you. We hope you get some time off this weekend. So thank you for joining us, and we will get this posted tomorrow.
Thank you, Linda.
Thanks.